Well, children are more at risk of abuse and violence than any other group. And in fact, Childline reported a 36.8% increase in calls during August of 2020 than in the previous year. And those called in to help are child and youth care workers. Well, their often thankless efforts are celebrated during the International Week for Child and Youth Care Workers. So let's get more on this with Alfred Harris from the South African Council for Social Service Professionals, who's taking part in a summit on this issue. Mr. Harris, thank you so much for your time and good morning to you. I mean, when we look at some of the figures, at least in as far as Childline is concerned, reporting that over 36.8% of, some of the calls they received last year in August pertained to children being abused, some negligent and neglected. Just paint us a picture of the reality on the ground in terms of what children really go through in South Africa.
Good morning to Mel and good morning to all the ENCA viewers. Thank you for this opportunity to be able to represent the 11,832 registered childcare workers around this country, who at this moment is very eager to see things happening for them in their life. So yes, Tamela, we do experience high levels of children being abused, and we just recently had the incident of the young girl who unfortunately lost her life through bullying. And these are the areas where child and youth care workers can really play a part in protecting children, because we believe as child and youth care workers that we work in the life space of children. Now, the life space of children is designed, is termed to be the space where children are. So if you look at the number of reported cases of child neglect and child abuse, now we must also understand that there's no way that we will be able to stop every incident of child abuse, but yet we can make sure that we have the people in the right places to be able to protect these vulnerable children. Right. And in terms of what's happening on the ground at the moment, in terms of services, we have a cohort of child and youth care workers that work in community in our very poor communities in this country where there's a lack of resources. They are called Isibindi child and youth care workers, who are specifically trained to address the issues of children, vulnerable children in the poorer communities in our country. And these child and youth care workers are really being sidelined in many ways, because these people who have been trained and qualified are still being paid a stipend. And in some cases, the people wait up to 3 to 6 months for their salaries to be paid, which is an indictment to the sector as a whole. Yeah. But on the ground, we have the feed ready to respond to the needs of vulnerable children. Absolutely. And with that being said, and just speaking of some of the conditions with which child and youth care workers continue to endure, has there been engagement between, organizations as yourselves as well as government to sort of exacerbate intervention and expedite some sort of financial relief as well as support for these caregivers? Okay, let me just say that. Remember that the South African Council of Social Service Professionals is a regulating body. Right. We regulate the practice of child and youth workers through regulations. So we have a role of regulating, but also we have the responsibility of advocating for the rights of child and youth care workers. And the Professional Board for Child and Youth Care Workers has been engaging with National Department of Social Development over a long time, and also with the Department of Administration, Public Services and Administration, in order to address the issues within the child and youth care fraternity. Up to this stage, Tumelo, we haven't had the success that we think that the sector should be experiencing. For instance, one of the issues that we are sitting in is it's a dichotomy that the Professional Board and Council sits with. Because, you see, as being a regulating body, it is important that we make sure that child and youth care workers who are practicing are registered to practice. However, those very same child and youth care workers who are supposed to pay a registration fee are not paid their salaries. Yeah. So we found ourselves in that conundrum of saying that you have to pay your registration fee, but yet people are not paid a salary. So some people, like I said earlier, some people wait up to 6 months for the salaries to be paid, and yet they must pay their registration fee. So these are the discussions that, as you said earlier in your introduction, that we will be having at the summit today. Yeah, and I wanted to touch more on that, because it's happening today. And for our viewers who don't know, it's called the International Week for Child and Youth Care Workers. This is sort of a commemoration and a celebration, but through the summit that you'll be hosting, you're addressing these issues. What are you hoping to be the outcomes from the summit? Yeah, so there are 3 main things that we are focusing on in the summit. The one is the issue around career pathing for child and youth care workers within the public sector. So now we have child and youth care workers who have completed a degree in child and youth care work, but there's no career pathing for them. And so they then take another route for them to go and work and find good opportunities. Second thing that we want to address is that there's no access for child and youth care workers to bursaries, and there's no tertiary education opportunities available for child and youth care workers. Then we also want to address the issue around the payment of and the non-payment of the stipends for child and youth care workers that work in these bindi or community-based programs at the moment. We feel that it is an indictment to the sector that they are not being recognized as being full participants of providing services to vulnerable and at-risk children in our very, very poor and struggling communities. So these are the things we will be addressing today. And I hope that we will see ENCA and other news media at our summit today to be able to report on this very, very important juncture for the field in South Africa.
All right, an important service with which healthcare workers are provided there. Thank you so much. Alfred Harris from the South African Council for Social Service Professionals.